Hello, my name is Kristin Morrow, and I'm a registered dietitian-nutritionist for Doylestown Hospital. Today I'm here to talk to you about how to make good dietary fat choices to help reduce inflammation in the body. Inflammation is a localized protective response of tissue to injury, irritation, or infection. It's the body's response to something going on that is harmful or irritating. It's a biological response to remove that injury or irritation. The body is trying to heal itself. Signs and symptoms include heat, redness, swelling, pain, or loss of some function. There are two types of inflammation: acute and chronic. Acute is short-term and is a sudden onset that's marked by heat, redness, swelling, pain, or loss of some function. This can be from sunburn, fever, or swelling. Chronic inflammation, on the other hand, is the long-term inflammation that lasts months to years and is a result of failing to eliminate the cause of the acute inflammation. Conditions include heart disease, cancer, autoimmune disorders, arthritis, Parkinson's disease, diabetes, and Alzheimer's. Causes of inflammation include obesity, oxidative stress, or when harmful free radicals or unstable molecules damage the body, and diet. Today we will be focusing on diet. There are several types of fat in our diets. The type of fat that we choose can make a difference either in promoting inflammation or helping to decrease it. We will discuss each of these types of fat in more detail, but ideally we should aim to eat more fat from plant sources and less fat from animal sources. Too much fat from any source can lead to weight gain that can also increase the risk for inflammation. Saturated fats can cause inflammation and increase risk for heart disease, especially if consumed in excess. Saturated fats have been found to trigger fat tissue inflammation. Saturated fats come from both animal and plant foods. These can raise the level of LDL, or harmful cholesterol, in the blood. Foods that contain more saturated fat are usually solid at room temperature, such as shortening, coconut oil, and butter. It's also found in red meat, cheese, and poultry skins. The American Heart Association recommends limiting saturated fat. Although there is a lot of conflicting information about saturated fat, the American Heart Association still advises to limit them, which decades of science have proven can raise the LDL, or harmful cholesterol, and put one at higher risk for heart disease. Trans fats are man-made fats that change a fat that is normally liquid at room temperature to a solid state, such as a stick margarine. These fats should be completely avoided. Trans fats, also known as hydrogenated oil or partially hydrogenated oil, are found in foods like donuts, baked goods, cookies, crackers, cakes, and stick margarine. Trans fats are used because they give food taste and texture that food companies and restaurants feel customers want, and they also help extend the shelf life of the product. However, trans fats raise the LDL, or harmful cholesterol, and lower the good HDL levels. This in turn can increase risk for developing heart disease and stroke. It is also linked to an increased risk of developing type 2 diabetes. Trans fat is set to be removed from commercially made foods later this year, 2020, but continue to be vigilant about avoiding trans fat due to its harmful effects while it remains in the food supply. Now we're on to anti-inflammatory foods, the ones that help to fight inflammation. We want to include more of these foods in our diets. Omega-9 fats, also known as monounsaturated fats, are considered anti-inflammatory fats. They are plant source fats. These include olives, olive oil, nuts like almonds, avocado, and nut butters with separated oils. Stir separated oils back into peanut butter or almond butter before eating it to ensure that you get the healthy fats. These fats help to lower the harmful buildup that can occur in the arteries, improving overall heart health. Omega-3 fats are another type of anti-inflammatory fat. Examples include fatty fish like salmon, grass-fed meats, dark leafy greens, flax seeds and flax oil, walnuts, and fortified foods like omega-3 enriched eggs. Omega-3 fatty acids have become popular because they may reduce the risk of heart disease. The American Heart Association recommends eating fish, particularly fatty fish, like lake trout, herring, sardines, and salmon, at least 2 times per week. Research has also shown that omega-3 fatty acids reduce inflammation and may lower the risk of chronic diseases such as heart disease, cancer, and arthritis. And they may also improve memory and brain performance. Fish oil is one of nature's richest sources of omega-3 fatty acids. Comes from oily fish. Best sources are cold water fatty fish, and it's a concentrated form of omega-3 fats. Fish oil benefits include decreasing the risk of heart disease and stroke. Fish oil does have blood thinning properties, and therefore it is important to talk to your doctor before starting any fish oil supplements, especially if you are taking anticoagulant medication. Omega-6 fats are found in safflower, grapeseed, sunflower, wheat germ, corn, walnuts, and soy, among other foods. Most omega-6 fatty acids in our diet come from vegetable oils, but there are some found in animal meat, butter, and egg yolks. Although over the years omega-6 fats have been considered pro-inflammatory or causing inflammation, research is now showing that these fats can help decrease inflammation when they replace saturated fats and trans fats in our diets. It is a tricky balance, and we should still aim to eat a higher ratio of omega-3 fats in comparison to omega-6 fats. Currently, the American diet tends to contain many more times omega-6 fats than omega-3s. Ideally, we need to decrease omega-6s to better balance with omega-3 fats. One diet in particular that focuses on the balance of omega-3 and 6 is the Mediterranean diet. The Mediterranean diet suggests ways to achieve healthier balance between the omega-3s and 6s. It tells us to eat foods that are rich in omega-3 fatty acids, including fish, nuts, seeds, and plant oils. Also tells us to replace butter with a healthier fat option such as olive oil or canola oil. The Mediterranean diet encourages us to use herbs and spices instead of salt, limit red meat to no more than a few times per month, eat fish at least 2 times per week, and choose skinless poultry 2 times a week. Drink red wine, but only in moderation, keeping to a 4-ounce glass a day if you choose to drink alcohol. Studies have shown that people who follow the Mediterranean diet pattern are less likely to develop heart disease. How can we reduce inflammation through food choices? We can cut down on eating pro-inflammatory foods, like that in processed snacks, desserts, and fried foods. And we can try to increase anti-inflammatory foods like fruits, vegetables, whole grains, nuts, seeds, plant oils, and fatty fish. Aim for a healthy weight. Obesity increases inflammation, so reducing your body weight through healthier food choices and exercise habits can also help reduce overall inflammation. Here is an example of a shopping list with foods that you can buy to help choose healthy fats and reduce inflammation. The list includes avocados, extra virgin olive oil, salmon and other fatty fish, grass-fed beef for moderate consumption, almonds, olives, chia seeds, omega-3 enriched eggs, and flax seeds. Here are some additional shopping tips. Look for avoiding predatory fish. These fish have a higher mercury level than other fish. They eat other fish, so their mercury levels rise. This includes tuna, king mackerel, shark, tilefish, swordfish, and halibut. Albacore tuna has a higher level of mercury than chunk light tuna. So choose chunk light tuna in moderation, but limit it to once or twice a week. Grass-fed beef, because grass, believe it or not, contains some unsaturated healthy fats and more omega-3s than grain-fed meats. Omega-3 enriched eggs are another source of dietary unsaturated fats. And finally, cold-pressed oils have avoided the negative effects of heat processing, which can change the chemical makeup of a healthy fat and cause it to lose some of its health-promoting properties. And here's the final takeaway. Be sure to look at your current dietary fat choices and look for ways to increase omega-3 fats and monounsaturated fats while reducing saturated and completely avoiding trans fats or hydrogenated oils. Eat more plant-based foods, fruits, vegetables, whole grains, and less animal-based products. Little changes can result in big health improvements when done consistently. Thank you for joining me. If you would like additional support or individualized nutrition counseling, please contact us at 215-345-2168.